So, good afternoon, everybody. Thank you very much for joining us today for this webinar, where we will be discussing the recent report targeting the European Commission, the 7 lobbying techniques of big tobacco. My name is Sascha Marchang. I'm the acting Secretary General of the European Public Health Alliance, and I'm one of the co-authors of this report, which will be discussed also in the context of the implementation of the WHO Framework Convention on Tobacco Control, which from now on I will just call the FCTC, because it's a little bit shorter. And in particular, we will focus on Article 5.3 and its relevant guidelines, which came into effect already back in 2005. So here we are 16 years later, still talking about the most appropriate implementation of these. The report that you will have seen, hopefully, is about contacts between tobacco lobbyists in particular and the European Commission. Having said that, the 7 tactics that were identified in the report, I think these are also globally relevant. So we do have participants here, I know, from the Americas and from, I think, even from Asia, maybe Africa. I'd like to extend a particularly warm welcome to those of you from far, because you're in a different time zone. So thank you all for being here. We're honored to have 2 members of the European Parliament with us. I will hand you over soon to Ms. Željana Zovko from Croatia. And we also have Mr. Manuel Pizarro from Portugal here, Ms. Zovko representing the EPP group, Mr. Pizarro, the S&D group. Before I do that, just a few words about the report and some little housekeeping rules. The report that you can also download, by the way, on the IFA website, you've probably seen it as part of the registration process, was researched and drafted by IFA and the Corporate Europe Observatory, and financed by the Tobacco Control Research Group at University of Bath, which is the research partner in STOP, the global tobacco industry watchdog. We released the report back on the 10th of March. That was 1 week after the World Cancer Day and the release of Europe's Beating Cancer Plan, which is one of the big flagship initiatives of the new European Commission that I'm sure you are aware of, and a big element of the new EU for Health program as well that was discussed today. Also, I think the findings of the report are particularly relevant with a view to the review of the Tobacco Products Directive that may or may not begin this year, and then also ongoing discussions about the Tobacco Excise Directive. A few words about IFA. The European Public Health Alliance is a large network of various organizations working on public health, patient organizations, disease-specific organizations, healthcare professionals, representatives of vulnerable groups, some researchers, etc. And together we sort of are the people-centric public interest, let's say, advocacy arm of the public health community. And that means we are working on a very wide range of topics. Tobacco control is one of them. I'm not an expert on tobacco control myself, I'm going to say it right away. However, we do obviously have members, some of them are here today, who are expert on that issue. For us, it's also of interest in the context of the realization really that the pandemic has brought us, that public health is important and that there is a value in stepping up European coordination in public health to also increase the funding for public health. And just today there was a long workshop on the new EU for Health program that some of us have followed. So there are much higher ambitions out there. One of the ambitions in Europe's Beating Cancer Plan is to achieve a smoke-free generation in Europe by 2040, for example. And to tackle various forms of cancer. We will revisit that later. At the same time, however, we've also seen that the tobacco industry, maybe not so much in Europe, but certainly globally, has taken advantage of the pandemic or tried to take advantage. And this has been recorded in the 2020 Global Tobacco Industry Interference Index, for example. For us also at IFA, as a final sort of point, this topic is of interest in the context of EU international trade agreements, so free trade agreements that the EU is currently negotiating with partners around the world. And for example, some tobacco lobbyists are trying to weaken the clauses related to rules of origin, among many other things that are of relevance there. So just a few housekeeping rules, maybe. Attendees' mics and cameras are muted and off, so unfortunately we can't see you. Speakers' cameras are on, but I would nonetheless ask you to remain muted when you're not talking. Questions can be asked, of course, and we have two options there. The actual questions, I would like you to ask them via the Q&A feature. So if you hover your mouse at the bottom of your screen, you will see Q&A and chat. Q&A is for questions, and chat is literally if you want to leave some comments or share some links, etc., but not for questions, please. Given that there are many participants, we will be moderating the Q&A. I may not be able to address all of the questions. My colleague is trying to filter out some of the questions that are most relevant, and we're also using text. So in case I don't see them myself, I will at least be aware. Finally, we are recording the meeting, and we will make it available online afterwards for those of you who need to leave for whatever reason, or anybody who wasn't able to join us. And we did not invite the tobacco industry as per Article 5.3. Okay, so much for my introduction. It's now a great pleasure to introduce one of our MEP hosts, which is Ms. Juliana Zovko, who's originally, I believe, from Bosnia and Herzegovina, I read, but has been an MEP for Croatia since 2016. She's also a co-chair of the MEP Lung Health Group in the European Parliament, which is an informal platform for policymakers, health professionals, and patients to identify the potential EU policy measures aimed at improving lung health. And I know you've done a lot of other interesting things around the world. Welcome, and over to you.
Thank you very much, and thanks for inviting me to this interesting and very beneficial and informative event in order to raise awareness how much important it is for our citizens to take care of their lung. And as a co-chair of a lung health group, I am trying together with my colleagues, and I would like to salute my colleague Manuel Pizarro here. We are trying to raise awareness on what we can do to help all these patients that have issues with the lung health, and what can we do in order to prevent serious diseases. So I consider this event very beneficial as well. So prevention of smoking from smoking is one of the key issues how we can save our lung health. So it is a pleasure to have you all today at this conference, and I would like to thank European Public Health Alliance for the organization. Health is becoming steadily more important at EU level under Commission President von der Leyen, who has called for a stronger European health union. The COVID-19 pandemic has even reinforced the call for promotion and coordination of health at European level and led to the creation of EU for Health program. As a co-chair of the MEP Lung Health Group, together with my colleagues, we actively stimulate discussion in the European Parliament on health policies in the European Union, with a focus on lung health and respiratory diseases. The Europe's Beating Cancer Plan is a key piece of the EU health puzzle, and a fine example of the health and all policies approach. Every year, 2.6 million people are diagnosed with cancer, and it kills another 1.2 million people in the European Union. Today, Europe has a quarter of the world's cancer cases, with less than 10% of its population. I'm encouraged by the plan's comprehensive multi-pillared approach to tackling cancer. As a flagship initiative, introducing an integrated package of measures across prevention, detection, treatment, and care, it illustrates the added value that the European Union can bring to Europeans when it commits to a strong health agenda. Cancer is therefore an important issue for my group, the EPP at the European level, and we support the Commission's initiative to leave no stone unturned in the fight against cancer and look forward to seeing it take over coming months and years. Among other initiatives, the Beating Cancer Plan envisions to achieve a significantly reduced tobacco consumption, and this is crucial, and we need to join our efforts to achieve this through policies. Tobacco consumption continues to be the leading preventable cause of cancer, with 27% of all cancers attributed to tobacco use. By eliminating tobacco use, 90% of lung cancers might be avoided. We welcome the Commission's target to create a tobacco-free generation, where less than 5% of population uses tobacco by 2040. The reviews of Tobacco Products Directive and Tobacco Taxation Directive, along with the legal framework of the cross-border purchases of tobacco by private individuals, will be key in this respect. Of course, policy making does not occur in a vacuum, as the report being launched today shows. In order to ensure that the Europe's Beating Cancer Plan and reviews of the relevant directive delivers results for health, there must be also transparency around the policy-making process to ensure that health is prioritized and ambitious goals can be attained. Transparency in health policy is therefore key. We have seen that in connection with EU COVID-19 vaccine contracts. It is important to promote transparency around all policies making and lobbying, including that around tobacco. The report presented today raises these issues and stimulates the transparency debates. Therefore, without further ado, I believe we can listen to the first presentations, and I'm looking forward to our exchanges of views and to discussions on the actions that the European Commission can take to improve that transparency, to reduce tobacco-related deaths, and better protect the public health of our Union. From our side, from the side of European Parliament, we will watch carefully in adopting all the further legislations. Thank you very much.
Great. Thank you very much, Mrs. Zufko. I very much appreciate it. And of course, also, it's good that you're reminding us of some of the statistics out there, which again remind us of why this discussion is so relevant. In the interest of time, I'm going to move up because I also didn't see any questions asked. So I understand you may or may not be with us for a little while, but that is understandable. You are busy. We have European Ombudsman Emily O'Reilly with us as well. So this is the other distinguished guest today. And obviously her role, among other things, is to investigate maladministration in the institutions and bodies of the European Union. And this debate about properly implementing Article 5.3 has been going on for a while, and there has been a conversation, let's say, going on between the Ombudsman and some of the Commission directorates that we will hear about. Just a little bit of background about Mrs. O'Reilly. She was first elected as European Ombudsman back in 2013, and then she was re-elected in 2014 and most recently in 2019. And prior to being the European Ombudsman, she was already performing that role back in Ireland for, I think, a good decade or so, earned a couple of honorary law degrees through this role. And in a previous life, she was also an award-winning journalist, author, and political editor. So we're very curious to hear from you, Ms. O'Reilly, to learn more about the Ombudsman's thinking and about action and inaction in this area, let's say. Over to you.
Okay, thank you very much, and good afternoon, everybody. And thank you very much for inviting me to what I consider to be a very important event. I was actually thinking about this event at lunchtime when I went for a walk, and I just want to share with you some of the thinking I had from people that I met on that walk. I live in Strasbourg in France, and directly across from my apartment is a lycée. So there are kids there from the age of 12 to 18, roughly. From what I understand, it's a highly academic lycée, and the children who go there in general come from middle class, well-educated, well-informed families. And ever since I've been living here for the last several years, I am constantly astonished by the number of those children who smoke. Walk out onto the street, the kids are just coming out directly beside the school gates, and therefore in full view of teachers and perhaps parents, they are smoking. And I'd say roughly a third or half of them are smoking, very young, 15, 16 years of age. You spoke at the beginning about ambition for a smoke-free generation by 2040. I'm surprised that hasn't happened yet, certainly among a cohort of young people who are the best informed and the best educated and possibly the best protected by their parents and the health system in relation to this. So I just wonder, why is that still happening? Is it cultural? Is it a part of the lobbying process? But I have to say, as a mother, as a human being, it saddens me to see these beautiful young children, when they're being so careful of their health now in relation to COVID, doing this. And even though when you're young, you think you're invincible, you're not, and certainly not when it comes to cigarettes. But anyway, that's my opening personal comment. So as the last speaker said, we are all living through this collective experience of COVID, and I don't think we've ever focused so much on thinking about our own health and the health of our families. So that is why this is particularly timely. So there is, as you say, a very lively public debate about healthcare regulation in Europe, and all of that. And I think the pandemic is going to make profound changes in terms of the way we move forward. So a part of this debate also quite rightly focuses on accountability and transparency aspects of the interaction between public authorities and private sector stakeholders, in this case, the tobacco industry. And of course, as already mentioned by the speaker beforehand, we see how important transparency is in relation to the rather contested issue of those COVID vaccines. The topic of today's event is of great importance: the need for strong safeguards to protect public decision-making concerning tobacco products. You've mentioned the WHO's Framework Convention on Tobacco Control, and it is based on the principle that there is a fundamental and irreconcilable conflict between the tobacco industry's interests and public health policy interests. And I think the word irreconcilable is the most important there and should be recognized. There should be no meeting ground between these two sectors. So as European Ombudsman, my mandate is concerned with good and bad administration. So therefore, undisclosed or improper interactions of the EU administration with the tobacco industry can be grounds for my office to open investigations. In June 2014, at the start of my tenure as Ombudsman, I opened an inquiry into whether the Commission was meeting its obligation under Article 5.3 of the FCTC, which compels it to be transparent in its interaction with the tobacco industry. The case was based on a complaint from Corporate Europe Observatory, who have co-authored the report of today's event, and well done to them. The complaint alleged that the Commission, with the exception of DG Sante, the Director General for Health, was not proactively making public all information on meetings between the Commission and the tobacco industry, and was thus in violation of the letter and the spirit of the FCTC Convention. The information could in fact only be accessed via specific requests to documents requested. So in other words, it wasn't that they were keeping the documents secret. You could get them, but only if you went through quite an elaborate process through Regulation 1049. So in October 2015, having analysed the issue carefully, I recommended that the Commission should apply DG Health's proactive transparency policy to all Commission officials, irrespective of their seniority. In other words, whoever meets with the tobacco industry, that should be noted and made available proactively. very disappointingly, and actually surprisingly to me, I remember having a conversation with Vice President Timmermans at the time, who relayed the bad news to me that their legal assessment was different to mine. Because I thought, you know, to put it sort of not quite facetiously, but I thought it was an easy win for them. It wasn't a difficult thing to do. And I have to say, it has puzzled me to this day why that did not happen. So the Commission replied that in its view, the general ethical and transparency rules already prevent undue influence from the tobacco industry, as its highest ranking staff members and the commissioners themselves were under special obligations. But the FCTC itself states, in setting and implementing their public health policies with respect to tobacco control, parties shall act to protect these policies from commercial and other vested interests of the tobacco industry in accordance with national law. So if there is no timely information available on all of the meetings, whether at commissioner or desk officer level with the tobacco industry, then how can the public take a view as to whether tobacco control policies are adequately monitored and enforced? Article 5.3 says that parties should require rules for the disclosure or registration of the tobacco industry entities, affiliated organisations and individuals acting on their behalf, including lobbyists. The FCTC therefore does not make a distinction between senior and other staff. I close my inquiry with the conclusion that the refusal to apply the proactive transparency policy of DG Sante, DG Health, across the entire Commission amounted to maladministration, and what was true then is true now. I was, however, pleased to read that DG Taxud has now agreed to start making minutes of its meetings with the tobacco industry public, and that is a positive move in the right direction. And it shows that change sometimes takes time and requires perseverance, although the amount of time and perseverance that is needed in this issue I find, again, quite surprising. So now may be the time to step up all monitoring and enforcement activities, and from this perspective, your report is exceptionally timely. Currently, key pieces of tobacco-related legislation loom large on the horizon, as you know, legislation on which the Commission may propose changes. And I would like to remind you, as you probably know, the research of the Tobacco Control Research Group of the University of Bath, published in the British Medical Journal on the lobbying activity in relation to the 2014 Tobacco Products Directive. The conclusion, the directive had been the most lobbied dossier in the history of the EU institutions up to then. When the stakes are this high, one would expect that the Commission would reflect carefully on whether more transparency around its interaction with the tobacco industry should in fact be embraced, like a form of health insurance. Finally, we should not forget to join the dots, make the links across the civil service, especially bearing in mind the sophisticated and intricate tactics used by the tobacco industry. In this vein, the Commission recently authorised a former commissioner to join a global communications consultancy, which listed Philip Morris International as one of its largest clients in the EU Transparency Register. I thought it important to contact the Commission on this matter and allow it to reassure the public that it will take all necessary steps to ensure that it meets its obligations under the FCTC by monitoring the compliance of the conditions it has placed on the former commissioner. Finally, I would like to reiterate that transparency of tobacco lobbying is not a question of policy. It is an obligation under an international convention that the EU is a party to. In other words, it's not optional. Thank you.
Thank you very much. I think that was very clear, and it provided us with a little bit more background information there. I'm just checking the Q&A because I don't think anybody asked any formal questions. I was myself curious, so you concluded maladministration out of your legal review at the time, and what are the consequences then? Is there no process where then the different DGs have to sort of explain themselves to you? How does that work?
Well, at that point, it was Vice President Timmermans on behalf of the entire Commission.
Okay, yeah.
That was answering, and as I said, I remember when he telephoned me to tell me this, and I was surprised. And to this day, I wonder, you know, not being paranoid or overly suspicious what was going on in the background, because all we were saying was that they simply proactively note the meetings that are taking place at every level and across the Commission. And one assumes, well, I don't know how many take place, but one assumes that there may not be that many, given that they're supposed to be limiting the interaction in any event. Yeah, no, he said, well, our legal people do not agree with your legal assessment. But obviously the point was not just the legality of it, it was the spirit of it, which was important. I mean, you'll always find some sort of legal loophole to actually get you out of something that you don't want to do. But I think if you embrace the spirit of this convention, and I think this was the first convention that the EU had signed up. No, it wasn't, but it was one of the first EU conventions that the EU had signed up to as a bloc, if you like. So therefore, it was very important. Now, obviously, over time, there have been some changes made, but it's slow. But it was disappointing, given the Commission's commitment to public health, and given that there's no argument in relation to the damage that can be caused by tobacco products. Yeah, I mean, there were no sanctions that we could apply other than, you know, stating our disappointment and making it public, the fact that they had refused this. So, you know, that's why we will, you know, look forward to what will happen now when the tobacco directive has been audited or reviewed, and what's going to happen there in relation to lobbying. But, you know, given what the first speaker said in particular, I mean, we know the dangers, and so therefore I would have thought that something which is very straightforward to do, simply publish proactively the names or the times that you've been meeting the tobacco industry, is a very simple thing, but a very important thing nonetheless.
Thank you. I think it's also telling that the recent WHO report on good country practices in the implementation of the WHO FCTC Article 5.3 and its guidelines actually only mentions your office within the EU as you know, doing it properly and as an example to follow. So hopefully the next report released by the WHO in that area might also then mention TAXUD and others that might follow suit. So I know you don't have a lot of time, but we very much appreciated your inputs here. Feel free to stay as long as you like, and then when you have to go, you have to go. But feel free to listen to us further, because now we're moving on to the actual report, the content of the report. In a way, the FOI requests that my colleague Olivier, who will be the next speaker, made are part of a much longer story, because CEO, the Corporate Europe Observatory, have been doing this over many years. Basically not too much has changed over the years. And it's particularly that what was mentioned before, that this is probably an example of reactive rather than proactive transparency. And I mean, I noticed that myself when we did the requests, that the whole FOI process also is just so cumbersome. It's so difficult to get the right or to get information at all. In our case, the information was split into all kinds of different requests. Then either they were not answered on time, they were incomplete. The information that we did receive was quite patchy as well. So you know, it really took a lot of time to kind of like construct a little bit of a story out of this and to understand what they were talking about. I'm sure, Olivier, you might mention this again and go then a little bit more into some of these tactics. So Olivier Hudeman, he is research and campaign coordinator at CEO, and his expertise lies precisely in this area of EU lobbying. He's a political scientist by training, and I believe you're a dual Danish and Dutch citizen. So over to you.
Okay, thanks a lot, Sasha. I will briefly present the findings of the investigation and the report, and the recommendations as well. And as I do that, I will start the slideshow. I hope that will work with sharing the screen. The report titled "Targeting the European Commission: the seven lobbying techniques of big tobacco." Indeed, it zooms in on the lobbying context between the Commission and the tobacco industry. it's very clear, and we heard the examples from the previous speakers, that the tobacco industry has for a very long time been actively influencing policy making, also EU policy making. And with this report, we wanted to examine what the context between the tobacco industry and the Commission looks like at the moment, more specifically in 2019 and 2020, to get a very recent and up-to-date picture of what's going on. And that is, of course, at a particularly important time, as has been mentioned by previous speakers, with some very important tobacco-related legislation coming up for review, and the Beating Cancer Plan as well, which makes it even more important than at other times to protect EU decision-making from the influence of the tobacco industry. We also wanted to get an up-to-date picture and find out more about if there had been progress in how the European Commission implements Article 5.3, which was mentioned by the Ombudsman, which requires governments and also the Commission to protect public health policy making from the industry of the tobacco, from the influence of the tobacco industry. And we want to get an overview of what kind of tactics the tobacco industry was using. So to just introduce very briefly what the research looked like, we submitted an access to document request and hoped that it would be a simple process. One request that would cover all of the Commission, but soon that turned out to be a much more burdensome and very difficult journey. The Commission split the request in 8 different Freedom of Information requests, which is really turned out to be very, very difficult to monitor, to follow, and to respond to. Okay, there's the slideshow, very good. So it became a very difficult process. In the end, it did result in more than 100 documents being released. And those are the documents that we have then analyzed and presented in the report. Now, to zoom in on the findings, it became very clear from those many documents that the tobacco industry is very active in lobbying, and also in some cases successful in influencing different Commission departments. They do that through letters and emails that they send, through physical meetings, and through other types of contacts. And if we go to the next slides, we analyzed the different tactics used, and found 7, which I'll just list very briefly. A tactic of promoting untruths, of attempting to postpone regulations, of playing the victim, of protesting against the regulators, of preying on third countries, of pushing new technologies, novel products, and of playing the European Commission off against member states. There's no time to go into detail about these 7 tactics, but just to give you an example of maybe zooming in on the first 2. So the documents revealed very clearly that the tobacco companies and the lobby groups of the tobacco industry were trying to create doubts and thereby delay tobacco control measures. And for instance, they used studies that they had commissioned from consultancies with findings that were really tailor-made to fit the goals of the tobacco industry lobbying. So that's sowing doubt and thereby trying to delay tobacco control measures. That is a very typical tactic used that we found repeatedly in the documents. Those 7 tactics are not new. They have been part of what the tobacco industry has been doing for several decades. The big question is, what is the Commission doing to protect itself against these type of influencing tactics? Also important to mention is that the documents and the different meetings that were revealed through the Freedom of Information requests showed that the lobbying focused on 3 main issues. One was the EU's new track and trace scheme for cigarettes. Another was EU trade negotiations with third countries, that was mentioned by Sasha. And the third was tobacco taxation, and whether the EU should review its current tobacco taxation legislation. So the big question there is, what is the Commission actually doing to protect itself and the public health policy making of the EU from this type of influencing? What became clear from the Freedom of Information request and the responses is that there was a very different approach from different part of the Commission. There's a lack of coherence in how the Commission handles interactions with the tobacco industry. It's very clear that most Commission departments are failing to limit contacts with the tobacco industry, something that's really fundamental in the UN Tobacco Treaty, Article 5.3. And some Commission departments very clearly seem to accept meeting requests as if it was normal to have meetings with the tobacco industry, as if it was any other sector. So more or less an open door policy, and particularly DG Trade and DG Tax. DG Taxud had this approach. There was also a big problem with a failure to actually disclose the information. And that had to do with the way parts of the Commission seem to interpret the legislation around freedom of information and seem to prioritize the protection of commercial interests and not give sufficient priority to the public interest in actually being able to monitor who influenced decision making. And the general approach of relying on reactive transparency instead of being proactive about the interactions with the tobacco industry, it has been mentioned that is an approach that really is unsatisfactory, that really doesn't work. It's extremely burdensome. It's not something I can recommend anyone to try to do. You need a lot of patience and a lot of time. And I think it's equally burdensome for the European Commission as well. So there would be a big advantage, I think, for everybody in embracing proactive transparency of the kind that the European Ombudsman has been advocating and arguing very convincingly for. I should say there's one big exception within the European Commission, and that's the Health Department, DG Sante. They are the only Commission department that really takes the implementation of these UN rules seriously. They have a good policy of proactive transparency. They're publishing lists of meetings and notes of meetings with the tobacco industry. And they're also actively trying to limit these contacts by grouping them in a smaller number of meetings with different stakeholders being present at the same time. So a very different and far better approach. And that brings me to the recommendations from our reports, which are basically 3 key recommendations. The first one is that the Commission, in order to protect itself against tobacco industry lobbying, needs a coherent approach across all Commission departments. We see that the tobacco industry is using the incoherence that is there now to access those parts of the Commission that are open to tobacco industry influence. So a coherent approach is needed, and that approach should be one of proactive transparency across all Commission departments, with a central and easy to access register of all contacts with the tobacco industry. And in addition to that, what's really important, of course, Article 5.3 is about transparency, but it's also about protecting decision-making by limiting contacts with the tobacco industry. And for that to work, the Commission needs to finally develop a policy, a document that makes it clear to all Commission officials across all departments what is the right way to interact with the tobacco industry and how to actually limit these interactions and protect decision-making from the influence of the tobacco industry sector. So, so that is an important second recommendation. And maybe just to add for this point, that the Commission argues and has argued for a long time that the existing rules for transparency and integrity are sufficient to protect, to implement Article 5.3. That is our report shows clearly that that's not the case. The tobacco industry is able to influence Commission decision making because of this incoherent approach. And the only solution, really the only way to properly implement these UN rules is to have a set of specific guidelines, a specific approach for the tobacco industry. So the general approach is not going to be sufficient. There's really no way around a specific set of rules for the tobacco industry. And that is not a radical demand at all. If you look at the Netherlands, France, those are examples of EU member state governments that have a very ambitious and a good attempt at implementing Article 5.3, who are doing exactly this: proactive transparency and a clear set of rules for the tobacco industry and how officials should interact with them. So I think that is probably the most important to say at this point. There's much more detail on all of these issues in the report. Also, all the access to document requests are available online, as well as all of the documents that were released by the European Commission, all available freely online. So thank you for your attention, and I look forward to the discussion.
Great, thank you, Olivier. So thank you for going in more detail into the findings of the report. And again, as the Ombudsman also mentioned, so we've had responses. Some of you might have seen in Politico that DG TaxSud indeed accepted the report's recommendations and stated it will start publishing the minutes of such meetings on the web. So that's a minor breakthrough for us. On the other hand, DG Trade was slightly less forthcoming, stating merely that they're aware, obviously, of FCTC 5.3 principles, respect the guidelines, etc. However, they do not discriminate between stakeholders requesting meetings, whether they're business, tobacco, or other lobbyists, and civil society and NGOs. So that's they're treating it sort of like as an issue of favoritism. They're treating everybody equal, but obviously that's not quite in line with our three recommendations, and in particular the one, the third recommendation that sort of would broaden the interpretation of public interest to include transparency around these public health questions. So we will go down a little bit the memory lane now, and that'll be one of our members, Anka Thoma of the Smoke-Free Partnership. She's the director there since 2018. And I know that she's been a director of communication. She's been working in the run-up to the accession of Romania to the EU as an advisor there. And she's been building up basically her experience on tobacco control over many years. And she's the go-to person, one of the go-to persons for sure within IFA. If we have any questions there, normally take your lead. You're also working on Article 20 on research. Basically, some of your reports have concluded that big tobacco is blocking, delaying, or amending the implementation of policy measures. So that would be very interesting to hear a little bit your views about how that worked out, maybe in the context of the last tobacco products directive revision and other policies that you're working on. Over to you, Anka. Thank you.
Thank you, Sasha, and thank you for your work together with CEO, together with STOP for shedding light on tobacco industry tactics. This has been a lot of work over the last many years, and I want to express my gratitude publicly. Now, the Smoke-Free Partnership is a coalition of 50 organizations from all over Europe. We've been active in EU advocacy for about 15 years, but our network's experience goes back a lot further than that. So what I wanted to do today was to benefit from that collective experience and bring a little bit of history. I'm not going to go back 50 years, although I could. I'm just going to go back about 15, 20 years, and I'm going to focus it on the EU. So in 2009, SFP commissioned a report that was written by researchers at Bath, at Edinburgh, and in London, that looked at the industry documents published through US litigation and analyzed the tactics of the tobacco industry employed to influence the 2001 Tobacco Products Directive. And their description was very simple: block, amend, delay. The tobacco industry employed legal arguments, trade arguments, economic arguments to soften the blow on its business of a legislation that at the time was pretty advanced. Then a few years later, of course, TPD2 happened. And in 2015, researchers in Bath, together with some in Oxford and again in London, analyzed documents related to the latest Tobacco Products Directive process. And their description of the industry tactics were breaking the health silo. The tobacco industry used its influence on policy departments that were less aware of the FCTC and did not apply the Article 5.3 obligations correctly or consistently. The whole strategy was about singling out health as an outlier and sort of putting economic pressure against public health. So the industry arguments predicting some kind of economic doom, rampant crime, and all of this with no health impact for the Tobacco Products Directive. They also basically threatened, and indeed they did afterwards put forward lawsuits against the TPD, all of which were lost. This is a pattern. Then, of course, the Honorable Ombudsman talked to us earlier about her findings of maladministration and the surprising rejection of those findings. And now here goes 2021, and your report finds pretty much the same old. The tobacco industry still is active. It still exerts pressure on policymakers and employs pretty much the same tactics as ever. So we've got a few new little twists, but these reports are so strikingly similar that one just pauses and must ask the question, isn't it time we actually learn from the past to protect the future? And it's not like we don't know who we're dealing with. The tobacco industry is not our friend. It has never been our friend. It has never been a friend of the public, of public health, of public interest. It is not there for the public good. It is not there to make friends or save lives. The tobacco industry shares some similarities to any industry, which is it's there to, make some products, sell them for profit, preserve dividends for its shareholders. That's its responsibility to those who own it. But what makes this industry special is the fact that it is incompatible with life and incompatible with public health. And it has a well-documented track record of subverting public health policies to preserve its deadly products. So here we are today. A few weeks ago, the tobacco industry, the tobacco industry, not the tobacco industry, I'll set the industry aside. The European Commission announced a plan to achieve a smoke-free generation. Now, let's be clear. A smoke-free generation means the European Commission has committed to eradicate smoking, to eradicate tobacco. And as a result, it has committed to, driving this industry into economic irrelevance. We are talking about the end of an industry in Europe. We're not talking about, we're just going to make some changes here and there. So knowing that we have a commitment towards that, it is now time to actually put it in practice and look at what we know about this industry's behavior to protect its existence and protect future policy making. We're talking about a very ambitious legislative agenda, but also a very ambitious implementation agenda. And all we know about this industry is that it will try to fight at every step. Now we're talking about the Tobacco Products Directive. Okay, these reports that I mentioned before showed extraordinary efforts to block legislation that was, you know, a single piece of legislation. In the end, it contributed to 3 percentage points, 5 percentage points drop in smoking. But we're talking here about eradication and about the package of measures. So one would expect an all-out war against public health led by the tobacco industry. And we all policymakers should be afraid of the onslaught of industry pressure that we should expect. And in the absence of some strong rules to protect the policymaking process and the integrity of science and the integrity of stakeholders themselves and of input, that agenda cannot be achieved. The tobacco industry efforts are the single largest obstacle to tobacco control. This is known and well documented. So transparency, great, fantastic, first step. It's not enough. We need transparency. We absolutely must have transparency, but then we need to implement the recommendations in Article 5.3 about limiting the contact, about making participants to meetings declare their interests, declarations of interests. They are already applied by the WHO and the Conference of the Parties to the FCTC. It's very easy to apply them here. We need to know who we're talking to. The tobacco industry is hiding behind front groups, and surely Andy is going to talk about front groups. You must talk about front groups, and is being intransparent about funding. So we must know where the discourse comes from. We must know where the narratives come from, and we must always recognize that the tobacco industry is not actually there to make friends or save lives. So finally, just to emphasize that I could not agree more with Olivier about the fact that tobacco industry is not like any other industry, and that it must be ostracized from the table of respectable stakeholders. And the UN already has done this. The UN Global Compact has rejected the tobacco industry many years ago, and this is a business forum. The UN has guidance in place about rejecting sponsorships and partnerships with the tobacco industry. It is not hard to single out the tobacco industry. It's been done at national level, it's been done at global level, now it needs to be done at European level. So again, we have a commitment to drive this industry into oblivion. To hold on to it, we need to actually do it. Thank you.
Thank you, Anka. That was very impactful. And of course, you're right that it's taken us 16 years to get to this point of the debate. Now we have another 19 years until 2040. And really, we're only taking baby steps here to talk about transparency a little bit, when really this is just one tiny piece of getting to that goal of creating a smoke-free generation. I don't think, I'm just going to double check my phone if we've received any questions, but I don't think we have. I think keeping up the energy, because I know that Andy indeed is not only going to talk about front groups, but about fronts of fronts of fronts. So, and he is the next speaker, and therefore I think it's nice to bundle the two of you together. He'll talk a little bit also about the global dimension of the problem. Global in this case, unfortunately, even beginning with the UK and Brexit, because not part of the European Union anymore, sorry. And Andy is a senior research fellow in the Department of Health at Bath University, director of the tobacco tactics team at the Tobacco Control Research Group that we already mentioned. It's a part of STOP, funded by Bloomberg Philanthropies. And indeed, there's the Tobacco Tactics website, also overseen by him, that contains a wealth of information for those of you who would like to read more about it. But at this point, Andy, I'm very pleased to have you here, and we'll hand over to you.
Thank you, Sasha, and good afternoon, everyone. I might disappoint you and not talk that much about the UK, Sasha, but I will get front groups in there at the end. You know, as I say, good afternoon, everyone. I mean, we mainly want to focus on, you know, the European Union and Commission today. So I just want to make two very quick sort of related points. You know, firstly, as Sasha said earlier, you know, many of the tactics outlined in this report are not unique to Europe, and we see them being, you know, happening worldwide. And I want to give you two recent examples. You know, in the report, we highlight promoting untruths and the industry wanting to play the victim. And earlier this month, the South African press reported that British American Tobacco had called for a government inquiry after it did what they like to do, commissioned a report which found that the sale of illicit cigarettes and tax evasion in the country was, quote, at an industrial scale. So BAT was screaming, we need a government inquiry. And for years, BAT and other transnational companies, you know, they've tried to paint themselves as the victims here of tobacco smuggling. But the problem is, you know, we've known for decades that the industry is complicit in the problem and of smuggling its own product. And just 2 weeks before BAT published their own report, there was a great investigation by the Organised Crime and Corruption Reporting Project, which ran a story about BAT's involvement in tobacco smuggling in West Africa. And what they found is that billions of cigarettes, mostly made by BAT, are smuggled north through Mali, through West Africa, on their way to the grey markets of the Sahel and Northern Africa. And according to the OCCRP, the profits fuel, quote, Mali's armed conflicts, lining the pockets of offshoots of Al-Qaeda and the Islamic State group, as well as local militias and corrupt officials. And into this, so that, you know, these cigarettes are, you know, going via terrorists, and the conflict there is now spilling out across West Africa, and over 2 million people are displaced in Burkina Faso, Chad, Mali, and Niger. And this conflict is being driven by, you know, cigarettes are being oversupplied to the region by British American Tobacco. And ironically, many of those cigarettes originate in South Africa. So, you know, BAT is complicit in smuggling. And ironically, as for tax evasion, 2 years earlier, the South African Revenue Service announced that the company owed 143 million rand as a result of tax fraud and evasion. And, you know, just as Anka said, you know, this is an industry that loves to block, amend, and delay legislation. Elsewhere in Africa, the industry has a history of doing just that. And a Guardian investigation found that BAT and other tobacco companies have threatened governments in at least 8 African countries, demanding that they axe or dilute health laws. So, you know, this is an industry that's operating out of control in Africa. And it's also, as we've put in the report, you know, it's preying on new markets, not just with cigarettes, but with new products, including nicotine patches. And recently there was another great article by the Bureau of Investigative Journalism, which had highlighted how BAT has launched, quote, an aggressive £1 billion marketing campaign that leans heavily on social media, concerts, and sporting events. And it's trying to promote nicotine patches called Velo or Lift. And what it's trying to do is specifically target, you know, young people. And according to the tobacco giant, the key new areas for growth are Pakistan and Kenya. So, those two markets they see what are their most exciting opportunity for growth. And Martin McKee, a professor of public health at the London School of Hygiene and Tropical Medicine, told the Bureau that BAT seemed intent, quote, on creating a new generation that is addicted to nicotine. And ironically, BAT's PR agency in Kenya tried to bribe the Bureau's reporter in the country to stop the story. And all these tactics, you know, this is an industry, that's what it's doing in Africa. It's bullying, it's threatening, it's bribing. And the second point I'd very quickly like to make is that, you know, often countries in Africa and Asia look to the European Commission for leadership on issues such as transparency and tobacco. And in Europe, the industry wants us to believe it has changed. It can be the solutions to the problems it's created on health and also tobacco smuggling. But, you know, elsewhere, it continues to run amok. You know, it is smuggling, it is bribing, it is threatening, and it's killing its consumers and pushing new addictive products. And increasingly, it's operating not just through front groups, but it's operating through fronts of front groups too. So if DG Tax sits down with tax evaders, and DG Trade sits down with tobacco smugglers, and DG Sante sits down with an industry that's trying to hook a whole new generation to nicotine, then others will think that it's totally acceptable to do the same too. Thank you.
Thank you, Andy. I think, yeah, lots of food for thought you've given us there, and it's really good to make the global connections, particularly also to emphasize the role as a sort of beacon of light, really, for a lot of other countries around the world that normally they would follow. And if we don't get it right, then they definitely won't get it right, because they're that much more vulnerable in many ways. I think in the interest of time, we will move on to the European Commission now. So you've heard from many of the speakers here today. We're very pleased to have Mr. Alvaro de Hilera here, who is a member of the cabinet of Vice President Vera Jourova, and among other things, also responsible for the transparency portfolio. Now, I'd like to, first of all, thank the Office of Vice President Jourova, because they did maintain a contact, a communication with us over the last few months, and we did already discuss some of the findings with them prior to this event. And it was definitely our impression that we were falling on open ears, and that they are in the process of undertaking an internal review to kind of figure out how to do things better and try to sort of instigate a more across the government type approach. However, as I noticed before, and as we've also seen from the responses that we've received, most of the DGs are still sort of hiding between arguments saying, well, we've got the transparency register, we've got a code of conduct for the senior officials, other commission officials, they have ethical rules that apply to them across the board, plus you can make freedom of information requests. So that is their interpretation of Article 5.3 implementation. So we'd like to hear a little bit how the thinking is evolving around this from the Commission, or rather from Ms. Jourova's cabinet. So Alvaro, over to you, if you're there.
I am here, and I hope you can see me and hear me. Thank you very much, first of all, for the invitation. It is indeed a pleasure for us to be present in these events and to be in continuous contact with you, because we consider, of course, that transparency is very important. The Vice President is responsible for that in the Commission, and especially it is important in certain policy fields, certainly also when it comes to tobacco. There was a mention before to the Beating Cancer Action Plan, and there was also a reference that was included recently at our request also to to the WHO, FCTC, and the obligations of transparency in this respect. And there was also, and I'm quoting now, the reference to the fact that they should take fully into account the principles of the transparency register. So if you allow me, I will first talk briefly about the transparency register, because this is a new development, as you know. The negotiations on this were concluded recently. That was in December last year, and they were very difficult negotiations. They were dragging on for quite a number of years. The Commission proposal was originally tabled in 2016, and only 4 years later it was possible to reach agreement on a comprehensive package. This package was consisting, on the one hand, on the interinstitutional agreement itself, and then on a joint political declaration on conditionality by the 3 institutions. The reason why negotiations were not that easy was because one of the objectives was indeed to cover the 3 institutions involved in the legislative process, meaning also the Council. And because they are all very different, sometimes we like to think of the European Union as something very cohesive, where the institutions speak all with the same voice and function in the same way. But actually, all the 3 institutions are very different. They have different political and administrative cultures. So trying to reach agreement on a joint register based on common rules was far from evident. And that was the main reason why it was so difficult to reach agreement on this file. Now, what we have now is a mandatory transparency register agreed by the 3 institutions I mentioned. The package that was consisting of the agreement and the joint political statements touches upon a number of issues. In the interinstitutional agreement itself, we have the basic lines of how the mandatory transparency register functions. And there are 3 annexes to that interinstitutional agreement that are even more important, I would say, because one of them establishes the information to be entered by the interest representatives if they want to form part of the register. The second one is the code of conduct that these interest representatives must respect at all times. And the third one establishes a procedure for cases of non-observance of the code of conduct. And this procedure may end up, by the way, in finding the interest representative in question as non-eligible if it is proved that it was behaving in a manner not compatible with the code of conduct. And that means, in turn, that these interest representatives will no longer be able to engage in certain activities with the institutions. When it comes to the joint statement, it lists the minimum measures that institutions will make conditional on registration. And these include meetings of decision makers and staff with the interest representatives, the publication of these meetings, speaking at public hearings in the Parliament, membership of Commission expert groups, participation in certain events in the Commission, such as forums or briefing sessions, access to the institution's premises, and patronage for events. Now, I was mentioning before that in the Beating Cancer Action Plan, there was reference to the principles of the transparency register. When one looks at the interinstitutional agreement, these principles are basically 3: transparency, accountability, and ethical representation. The idea, or the main idea behind the register, is to make sure that every interest representative wanting to interact with the institutions will comply with these underlying principles, and the interaction itself as well. So this is important to keep in mind, because it's not the Commission's position that interaction with interest representatives is in itself the wrong thing. We do not consider this. We think that it is legitimate, of course, provided it is done in a certain way. And that, in the case of the tobacco industry, includes, of course, what is established by the FCTC Convention. But we must keep in mind that the idea is not to make it impossible for these interest representatives to actually interact with the institution. Now I'm speaking in general, not necessarily about the tobacco industry, but to make this interaction subject to certain principles. I would also say it's also important that there's an opening in the agreement for this register to also, it's open, sorry, for participation by other institutions and bodies of the European Union, because of course we focus always on the three legislative institutions, but there are many others which are important. We can think about the banks, not only the European Central Bank, but also the European Investment Bank and many others. And these, for the time being, they're not part of the register, but it is now open to them if they so wish to join. And certainly the Commission is making efforts and reaching out at these institutions and bodies to invite them to join the register whenever they consider this appropriate. Now, another important thing is that the register, which by the way will come into force probably by the end of this year, and the process leading to the register is not conceived as a stable result, if you want. It's a dynamic exercise, and this is so because every year there's going to be a report made by the three institutions on how the conditionality is being applied, and there will be also a review exercise. So the three institutions will be checking whether what we have in the agreement is sufficient and whether it's working well. An important point as well, and I think this is interesting for this debate, is that there will be a reinforced vigilance and control as to whether the interest representatives are actually complying with what is in the Code of Conduct. One of the criticisms we heard concerning the functioning of the current transparency register was that the rules were there, but then people were not taking them seriously, and it was sufficient just to make up a name and one was registered, and that was not actually the result we wanted. So now the idea is that we will have a reinforced control over this, and we will make sure that if interest representatives do not comply with the principles that we have there, they will be delisted from the register, and that means in turn they will not be able anymore to interact with the institutions. Now, as you see, this is an instrument that is not particularly focused on the tobacco industry, and the reason for this is that we consider that every interaction with interest representatives should take place under the highest transparency requirements, ethical requirements, and so on. So we want, I mean, this is not a race to the bottom, but it's a race to the top. We want that the highest standards are applied all across the board, including, of course, for the tobacco industry, but not only. So summarizing, and before coming to another instrument that I'm going to describe now, this has been focusing the efforts of the Commission in recent years. What we wanted is to make this new transparency register that would make it conditional on registration for interest representatives to interact with the institutions, to make sure that it covers at least the three main legislative institutions. And by the way, it will also cover the permanent representations of the member states whenever they are holding the presidency, at least. So that means that they will also be subject to the requirements established in the interinstitutional agreement, and on that basis start to build. So once we have this in place and we have a dynamic process that every year will look at how the transparency register is working and what can be improved, we hope that by the end of this term and this mandate, we will have a very strong and very solid transparency register that will make sure that we have good transparency requirements. I should also mention that in the interinstitutional agreement, the provisions there do not deal just with the register, because we have also said, and this is very clearly stated, that there are other transparency measures, such as the publication of the meetings, that we intend to make compulsory as time passes by. As you know, it is already compulsory for cabinet members, members of the college, and directors general, but the idea is that this will become, as time passes by, not immediately, but as we progress in the legislature, we will make it, we will try to make this compulsory also for staff members in general of the Commission. This about the transparency register. Now coming to another two other tools that the Commission is dealing with. Well, you know as well that we have internal guidance specific to the interaction with tobacco industry representatives. These guidelines were prepared by DG Santé. They have been reminded recently to all other DGs. As you have mentioned already, anyway, there is a certain difference in the application of these guidelines by the different services. And this is something that we are not necessarily happy with, if I may put it this way. We think, and leaving aside the substance of the degree of control over these meetings, but we think that the mere fact of having a different application of these rules in different services is a problem in itself. This should not be the case. This should not be the case, and we are looking at ways. I cannot advance now how we're going to do it, because simply we are still in the process of reflecting how exactly to do it, but we are looking at ways of making sure that the application of these guidelines, of whatever instrument will replace them, will be done in a more coherent manner by all Commission services. Because in our view, it doesn't make any sense that services can decide on their own what is the best application. And I'm not even judging what the best application should be, but I'm just saying it should be the same for every Commission service. So we are also looking at this. This is more specific to interactions with the tobacco industry. Last thing I wanted to mention, and I think this is also very important, there was also reference before I heard to the freedom of information. This is in the European context, the regulation on access to documents, which is also applied in a different way by different services. Here, what I would like to mention is that this regulation is already 20 years old. And I think this is sufficient to think that probably is no longer fit for purpose. So what we are considering, and again, we are a bit at the initial stages of the reflection process, but we are considering that this indeed will need to be reinforced and updated, also because the mere concept of the very concept of document is very different now from what it was 20 years ago. So we are also reflecting on this, and probably, I mean, I don't want to advance because I don't know, but this could probably take in the future the form of a proposal for a reviewed regulation on the matter, which would give additional rights to citizens, but also make sure that implementation is a bit more consistent, not just within the Commission, but also across institutions. And I think I will leave it there, if you allow me. Thank you.
Thank you, Alvaro. Appreciate it. And I know you've given us what you could for the time being, so I'm not going to corner you. Also, we're running a little bit late, just to remind everybody. We are now moving sort of into the panel part of the discussion, but there was one question for you, Alvaro, that colleague from the European Network of Smoking Prevention asks, and that is the FCTC is an international treaty ratified by the European Union and all member states. Why not include the FCTC requirements in the Transparency Registry Code of Conduct?
That's a good question.
It might be a question for all of us, but
that's a good question. But I would say, first, I would say one thing: the requirements are binding on the signatories, no matter what. And I think if we were to include this in the Transparency Register requirements, that would only be declaratory in nature, because they are already binding on us. They are already binding on us, and I think the problem is not whether they are there. The problem is how we apply them in practice, and the fact that it's being applied in many different ways. And I think what we have to, because if we were simply to replicate those principles and put them and write them down in the code of conduct, I don't think that would really change the situation. I think what we have to look at now is at ways of making sure that the application of the principles is done in a consistent manner across not only within the Commission, but also, and this is something we should not forget, by the way, because we are happy in the Commission that the focus is on us, but we should not forget that at the end of the day, legislation is done elsewhere. We make the proposals, but the decisions are taken in Council and Parliament. And I think the idea should be rather to make sure that the principles in the FCTC, which bind the Union as a whole, are being applied in a consistent manner within the Commission, but also across the institutions.
Thank you. So now we're going to address a number of final questions together with Olivier, Anka, Andy. And we also have Professor Jonathan Grigg with us. He is the incoming chair of the Tobacco Control Committee of the European Respiratory Society, which is another EFA member. He's a professor of pediatric respiratory and environmental medicine at Queen Mary University of London. So welcome, first of all, Jonathan. We wanted to know also from you, why is the issue of transparency in tobacco industry lobbying particularly important for the ERS? And also thinking about, which I think is tactic number 6, on pushing new technologies. So in relation to e-cigarettes, vaping, and heated tobacco, we wanted to hear from you about that. Over to you.
Yes, thank you very much, Sasha, and thank you for inviting me to the session. Very, very interesting. I'm actually a pediatrician, so the need to protect the young generation, young people from being hooked on nicotine and inhaling nicotine products, really very important to me. We welcome your report. Obviously, it's stating what is being widely known. There's no doubt that these pressures will increase significantly over the next few years. So it's a timely warning. We also welcome very much the Beating Cancer plan, because it gives us a focus on some of the things that we do need to do, including taxation, but also better and more rigorous regulation of the new electronic nicotine delivery devices, as well as encouraging research for the gaps that we have. And we should say that we recognize as society, at least for these devices, that there is a wide divergence of views about their role in smoking cessation, and there is no doubt that that divergence will be exploited by the tobacco industry in their lobbying and inducing uncertainty, or encouraging the uncertainty. And what we need is unbiased scientific research encouraged in this gap. So we recognize there's a gap, and then recognize the need to encourage the research. And we as a community, a respiratory community, are ready to do that research. I think the one point that I would point out is that we have examples of what happens when you have lightly regulated or unregulated use of these devices in America, and also in the United Kingdom, lighter regulation. And just as a personal example, just 1 mile away from me, my house in London, there's a shop called Shake and Vapes, where there's, on the left-hand side, there's a milkshake parlor. On the right-hand side, there's a vaping electronic cigarette shop. So I think this is where we are heading for in these environments, and something that we must really press against. So I think that your point 6, certainly for us, is very, very important, and the importance, of course, of lung cancer, a devastating disease with over a quarter of the affected people under the age of 60. So both of those, I think, a timely reminder, and the roadmap provided by the Beating Cancer plan. Thank you.
Thank you, Jonathan. That was really good. And wow, I wasn't aware of these new types of businesses out there, but indeed. Well,
there's shakes, cakes, and vapes if you want. There's another shop. Well, but that's another thing.
Okay, I won't have time to answer all of the questions. Sorry, to ask you all of the questions that I had originally indicated or in mind for some of you. We do have an audience question, however, that I would like to address because I think it's interesting. So this could maybe be for Andy mainly, but it could also be somebody else if Andy doesn't wish to answer. And it goes, we know that BAT, so British American Tobacco, was among those lobbying for the introduction of the better regulation agenda and its tools and processes. But did you find anything in your research for the report to indicate what specific elements of the are giving the industry undue advantage or enabling them to influence policy more readily? So what specific elements of the better regulation agenda are giving the industry undue advantage or enabling them to influence policy more readily? I mean, I'm co-author of the report, so I mean, I went through all of these documents. I can't really answer that question, to be honest. Colleagues, Olivier, are you there?
Yeah, I can try to answer that. I do remember seeing in different lobbying letters from the tobacco industry references to the better regulation agenda. I think it's used as a way to open the doors and get a conversation. That's very clear. So the tobacco industry does indeed use their interpretation of better regulation as a lobbying tool, indeed, to get the Commission to listen to their demands and their attempt to weaken tobacco control measures. That's very clear.
Thank you, Olivier. I wanted to come back to the fact that Article 5.3 goes beyond transparency. So it really is about actively protecting policymaking from tobacco industry influence. And this is something that Anke emphasized quite a bit. And then we heard from you, Olivier, that DG Santé, for example, they have these stakeholder meetings either for industry, where civil society might be invited as an observer, or stakeholder meetings for civil society where industry, I guess, isn't necessarily in the room. So that's good. But is that sufficient, Anke, in given that we have 19 years to move to a smoke-free generation? And also, is the balance right between these stakeholder meetings?
There's two different questions here, Sasha. No, it's necessary, but not sufficient. Transparency is necessary. Transparency is necessary in general, but especially with regard to the tobacco industry. With the tobacco industry, it is not sufficient. The tobacco industry has decades of lying under its belt. You can't just solve that. And the transparency of a conflict does not remove the conflict of interest. So something more has to be done. I mentioned declarations of interests and limiting and having some kind of process for determining what is a strictly necessary interaction with the tobacco industry as per the guidelines to Article 5.3. We need to get serious about this. Now, the question about balance is, I have to say, in the last few years, DG Santé has implemented this idea where, consultation with the tobacco industry are open to civil society observers. And it's been, it's been interesting, and it's for us, it's interesting to listen into this as content. But also it is an example of the spirit of transparency. You give, civil society, legitimate civil society, a voice. Now, the problem that we've faced recently is that tobacco industry is trying to infiltrate civil society. So distinguishing between independent NGOs and industry funded directly or indirectly, it's another can of worms that is opening, it has been opening for a long time, fronts, as Andy was saying. So it's very difficult. This industry never stops, and it has infinite resources, and it's just like this game of whack-a-mole where you hit one head and it keeps popping up somewhere else. So it's really, really difficult. What I also wanted to say, and it's a really important point, to Eleanor's question about the better regulation agenda, the fact that impact assessments are so economically focused and so not health focused it's been demonstrated that industries such as the tobacco industry many years ago had a hand in that design, that they've used it in the previous tobacco products directives, and the lack of a health impact assessment now is a weakness of the current regulation, the way regulations are made. So this has to do with something completely different, but it's really an existential thing.
Thank you, Anke. So I think you've summarized some of the things that otherwise I might have tried to summarize myself. And that is now very good, because we are running out of time, and we have our other MEP with us here, which is Manuel Pizarro from the S&D group in Portugal, who is also co-chair of the MEP Lung group in the European Parliament, and an MEP since 2019, so newly elected. And we're very pleased that you're still with us, despite the fact that we're running over time, to provide some closing remarks. Over to you, please.
Well, Thank you very much. It was a very interesting meeting. First of all, I want to thank European Public Health Alliance for promoting this debate and inviting me. I want to salute, of course, my colleague, the MEP Zoltana Zovko from the EPP. It's quite important that these issues are dealt in a cross-party basis here in the European Parliament. This report that was debated today presents and analyzes key contacts between the European Commission and the tobacco industry. And after hearing what was revealed, I must say that I am concerned. As a medical doctor and as a political leader, I feel the responsibility to repeat the obvious. Tobacco is the leading cause of illness and suffering, including from cancer. What to say? In one hand, the Commission proposes a very ambitious and comprehensive European beating cancer plan. Together with the new program for health, which was approved by the European Parliament some weeks ago, the EU for Health, with 5.1 billion euros budget, and the programs related with the R&D, Horizon Europe, and the Innovative Health Initiative, beating cancer pain is a good reason for hope. However, on the other hand, this report shows that tobacco industry lobbying is more and more active, and we cannot be completely sure that there is not some vulnerability from the European Commission side. I will repeat, there is nothing more important to do in the context of the European beating cancer plan than fighting against tobacco consumption. Big tobacco has been influencing policy to its advantage for decades. The World Health Organization Framework Convention on Tobacco Control, mainly the Article 5.3, is a real effort to improve transparency towards public health. Citizens have the right to know when public leaders meet with tobacco industry lobbying. However, we hear the European Ombudsman in this meeting labeling the European Commission behavior as maladministration. How can we be sure that the European Commission is not vulnerable to the influence of skilled industry representatives? We have the right to demand strict compliance of the different EC services with FCTC provisions. I was member of Portuguese government when in 2008 we delivered a first strong anti-tobacco legislation in our country. I was member of national parliament when there was a revision of the law in 2012. In both instances, I see the incomparable amount of lobbying organized by the tobacco industry. The final version of the legislative instruments was, in both situations, more favorable to the industry interests than the primary proposals. 10 years after, we should not accept the same at the level of the European institutions. I join my voice to yours. The Commission should proactively list all meetings and correspondence between Commission officials and the tobacco industry on a central and easily accessible public register. And I'm not speaking about a bureaucratic register. The minutes of the meetings should also be publicly available. At the same time, the Commission should outline and establish a clearly defined policy regarding how officials should handle contacts with the tobacco industry. And finally, the European Commission must interpret public interests to include transparency around lobbying and the protection of public health as overriding objections related to the so-called personal data and the protection of commercial interests. The health of people should be in first place. Thank you very much.
Thank you, Mr. Pizarro. Muito obrigado. We look forward to working with you in the implementation of the cancer plan. We just heard today at the EU for Health workshop that really the cancer plan is a transversal priority for the European Commission that really goes into all different areas from health systems to digital to NCD prevention, etc. So there will be a lot of work in our hands, plus, of course, the revision of the Tobacco Products Directive as well. With those inspiring words, then, unfortunately, it is time for us to say goodbye. We are running a little bit late, but I'm hoping we didn't lose anybody. Thank you very much once again to all of our presenters and our hosts. And please keep in touch with us at the European Public Health Alliance at Corporate Europe Observatory. If you have any questions, we're willing to make the contacts and find the information that you require. So thank you very much. Have a nice evening or nice day if you're elsewhere. Goodbye.